Hello, my wonderful viewers. Welcome back to my channel. In case you're seeing this video for the first time, my name is Dr. Obegeli Mbanefo. I am a family nurse practitioner as well as a mental health nurse practitioner. I have been teaching nursing students for over 7 years, and today I will be discussing heparin dosage calculations. So stay tuned. I'll be showing you how to do the calculations, how to decrease the rate, how to increase the rate, and also how to give the boluses. So let's get started. Here, students will be given this. This is just a sample question. I am not releasing exam questions, but this is just to help students who were not able to attend the tutoring section for them to have access and know how to do this heparin, because it's a very sensitive medication and very important that students understand how to calculate the heparin dose. So, weight-based heparin protocol. Order for heparin IV continuous infusion 25,000 units in 500 ml in 0.45 normal saline. At times, it may come in 50,000 units in 500 ml, but for this example, I'm using 25,000 units. For your exams, please pay attention on the order that you receive from the doctor or you were asked to follow. For IV boluses, he said use heparin sodium 5,000 units per ml. For boluses, we have to make sure we use the small vial that looks like the insulin bottle. I will show you how it looks in a minute. Patient weight, we have to pay attention to that because at times the weight will be given in kg. If it is given in kg, we don't have to do any conversion, we just use it. But if it is given in pounds, we have to make sure we divide it by 2.2 to get what is the equivalent in kg. The hospital policy is to administer a loading bolus of heparin at 40 units per kg before starting the drip. Please make sure you follow your hospital policy. Like I said, this is just an example. It is not for nurses to follow as a guide. It's just example for students to learn how to do this math. Okay. Then initiate a heparin drip at 18 units per kg per hour. Here, this part will be given as well during the exam. It said if APTT is less than 35 seconds, rebolus patient with 80 units per kg per hour and increase the IV rate by 4 units per kg per hour. If APTT is between 35 and 44 seconds, rebolus with 40 units per kg and increase the IV rate by 2 units per kg per hour. If the APTT is between 45 and 75 seconds, we don't have to do any changes. That means it is therapeutic. We continue with the current rate. If APTT is between 76 and 90 seconds, we decrease IV rate by 1 unit per kg per hour. If it is greater than 90 seconds, we have to hold the heparin drip for 1 hour and then decrease the rate by 3 units per kg. When we say hold, means stop the infusion. And note that you must notify your doctor if you have that range because it's very high. This is the little vial that we use for IV boluses. It's 5,000 units. It comes in 5,000 units in 1 ml. The next slide is the bag, heparin bag. Anytime we're infusing the heparin with comes in a bag. At times, the bag may come in 25,000 units in 500 ml, like this example. At times, it may be 50,000 units in 500 ml. Please make sure you use infusion pump. That's why I have this pump here for you to know that you have different hospitals have different kinds of pumps, but you have to use the one available in your facility. And another important thing is that heparin, you must have another RN to co-sign with you anytime you're giving heparin. So let's look at this example. It's a weight-based heparin protocol. Order for IV infusion, 25,000 units in 500 ml, 0.45 normal saline. For IV boluses, use heparin sodium 5,000 units per ml per vial. Patient weight here is 187 pounds. Like I said, at times it may be given in kg. You don't have to convert it if it is in kg, but if it is in pounds, you must convert it to kg because it's a weight base. We use kg. The hospital policy is to administer a loading bolus of heparin at 40 units per kg before starting the drip. Then initiate a heparin drip at 18 units per kg. So the question number 1 says, calculate the initial heparin loading bolus in units. Pay attention, it says in units. So step 1, bolus patient with heparin at 40 units per kg. We already know we have 40 units. To get our weight in kg, we divide the 187 pounds by 2.2 kg to get 85 kg. So 40 units multiplied by 85 kg, we will get 3,400 units. So 3,400 units is the answer to question number 1. So number 2, assuming you're asked to calculate how many ml will you administer for IV loading bolus. Now, students are asked to calculate it in ml. So the 40,000 units times 85 kg, that's how we got the 3,400 units per kg. So the 3,400 units divided by the 5,000 units times 1 ml will end up getting 0.68 ml. 0.68 ml. For question number 3, it said calculate the initial heparin rate in units per hour. Per our order, it says to initiate a heparin drip at 18 units per kg per hour. 18 units times 85 kg times 1 hour, that's how we got the 1,530 units per hour. So here, the answer, pay attention to the question. It said in units per hour. If you have this 1,530 units and you write it ml, it's a wrong answer because you're being asked to have what the rate is in units per hour, not in ml, because 1,500 units and 1,500 ml, they're not the same. Please pay attention to that. Question number 4 is said, what will be the continuous IV rate for problem number 3 in ml per hour? Here we are being asked to calculate it in ml per hour. Remember, in problem number 3, question number 3, heparin was initiated at 18 units per kg per hour. That's how we have the 18 units times 85 kg times 1 hour. We have the 1,530 units per hour. So to solve the equation for the continuous IV rate in ml per hour, we have to use the 1,530 units times 500 divided by 25,000 units. I'm using dimensional analysis, and the units will cancel off the units. So we'll end up having 765,000 over 25,000, which multiplied by ml to get, we'll end up having 30.6 ml per hour. So this is the guide I've already discussed how to use this heparin dose adjustment guide. It shows the results and also shows the interventions. So let's look at the next slide. The next slide here is said, after 6 hours, the heparin PTT is 36 seconds. So remember, we do the heparin PTT every 6 hours. So how many ml will you infuse the heparin drip at this time? So we have to go back to our drawing board. We find out we have 36 seconds. So 36 seconds is between 35 and 44 seconds. So we have to rebolus with 40 units per kg, and also increase the IV rate by 2 units per kg per hour. So how are we going to do that? I will show you. Remember to rebolus with 40 units per kg and increase the IV rate by 2 units per kg. That's what we are going to do here. Okay? We have to note our initial rate is 18 units per kg, which is 85 kg. We know how we got this. Okay? So we rebolus by 40 units. So 40 units times 85 kg, patient will be getting 3,400 units. That's what patient will be getting in units. That's for the bolus. Remember, anytime we're doing the bolus, we're using the little vial that comes in 5,000 units per ml. So step 2 is how many ml will you infuse the heparin drip at this time? The order says to increase the rate by 2 units. So we use the initial heparin drip, which is 18 units per kg, and we add 2 units to the 18. So therefore, 2 units plus 18 units will have 20 units per kg per hour. So 20 units times the patient's weight in kg will have 1,700 units per hour. This is the units, but we have to calculate it in ml because the order said how many ml. So 1,700 units divided by 25,000 units times 500 ml. We will end up using the calculator to get 34 ml. That's what the infusion pump will be at this time. Then, assuming after 6 hours, you did the heparin lab again and the result came back, you have 60 seconds. If it is 60 seconds, you have to go back to your guide. 60 seconds is between 45 and 75 seconds. Continue with the current rate. So that means there will be no changes. We don't have to do anything. We have to continue running heparin at the current rate. Our current rate was 34 ml per hour. So the rate will not be changed at this time. We have to continue with the same rate because it is therapeutic, and we'll recheck it again in the next 6 hours. Then after 6 hours again, your result came back and it's 80 units. You go back again to check. The 80 units is between 76 and 90 seconds. So here we have to decrease the IV rate by 1 unit per kg. So the 80 seconds, how many ml will you infuse the medication at this time? That is the question. So remember, per hospital policy, if APTT is between 76 and 90 seconds, we have to decrease the IV rate by 1 unit per kg per hour. So initial rate was 18 units times 85 kg. We have this. So to decrease by 1 unit, what we have to do is 18 units minus 1 unit, we have 17 units. So 17 units times 85 kg, we have 1,445 units per kg per hour. So 1,445 units times 500 ml divided by 25,000 units, still using the dimensional analysis, will end up getting 28.9 ml. Please pay attention. Some schools will ask you to round up, some will ask you not to round up. So pay attention and follow the instructions from your professor. Thank you very much for watching. Please do not forget to subscribe if you have not subscribed to my channel, and I will be discussing next generation NCLEX sample questions, the pathophysiology, the diagnostic tests, the medications, and nursing interventions. It is very, very good that students know the content. Knowing the content is the key. Know the content and know your interventions. Trust me, you will be passing your exams. Thank you very much. If you have not subscribed, please go ahead and subscribe. Thanks.